welcome Dr. Stephen Peters. And Steve, it's good to see you,
Hey,
my
buddy,
friend.
you bet. Always good to be here, Wayne.
It's been a while since you've been with us.
It has been a few months.
It's good to see you.
Yes, indeed.
Dr. Peters is the head of psychology at Cherry Hospital and a regular here on Wayne Goldsboro Television. Now,
Yes.
the hospital's been open in its new digs for about 6 months.
About 6 months now that we're in March. We're over there now at the new facility. Boy, it was the timing of it couldn't have been better because Hurricane Matthew came into town that very next week.
Yes.
And had we hesitated much at all, we would have been right in the middle of that.
Yeah.
And of course, that a lot of stormwater damage and flood really impacted the old campus. The new hospital was high and dry, and so we stayed in fully operational and really didn't have a problem. Parking lot got a little damp,
Yeah.
but we waded through that okay, and it was really not an issue, really.
And the old location, you would have been flooded.
Oh,
Easily.
those buildings have basements,
Yeah.
which is a lot of the mechanical service, electrical, heating and air is in the basements, and the basements turn into swimming pools, and that's not good for your electrical service.
No, it's
turns
not.
out.
Now, with in your new location, you have state-of-the-art everything.
Yeah.
And there's some tweaking that's been done.
Yeah, we have it's real high tech. It's a modern, large hospital, and with all that technology and gadgetry, is what I call it. Some of that's to be tested out, and then how do we make good use of it? A lot of them are safety features and convenience features that a lot of modern hospitals would have, of course. And as we're putting those under use, some of it helps us and some of it doesn't help us. And so we're trying to work around some of that and come up with what's really more helpful to us. And so there's a growing growth curve to moving us, a large hospital like this, into that facility. But I would say it's going very smoothly. It's really minor stuff. The other bigger systems that are more important, and just the advantage of being all under one roof.
Yeah.
We had 13 little buildings. It's really, if you had not been to the old campus, it was like a little junior college campus with 13 separate buildings. And so
13
hard to
separate
maintain,
buildings. Yeah.
all have water, electric, and various plumbing problems. And so maintaining that facility and running back and forth, particularly in foul weather, was a challenge. Well, it's just so nice that the food service is down on the first floor. You just put it in carts and run it up to the other patient areas, just like any other hospital.
And it's a beautiful facility.
Yeah,
It
thanks.
is.
I mean, yeah, you came out and had a little walk through.
Did. In fact, from time to time I'll run that. I may run that again soon as well, just to show people, anybody that may have missed it, I'll show that again. But I wanted to ask you, though, an issue arose here recently. It turned out to be a minor issue. It was not a big deal at all. But it gave you an opportunity, you and Lucky Welsh, to come out and talk to our county manager, George Wood. And I understand that was a pretty good meeting.
We did have a good conversation with Mr. Wood. We want to be good neighbors at Cherry Hospital with Wayne County. And so any concerns, it's just kind of probably should be talking with each other from time to time anyways.
Just touching base.
And if any things that come up, and now we know who to call, they know who to call. We're all doing real well now. So we're real pleased with sort of that increased communication we have with each other.
And I'm sure that there may be someone who's not aware of the breadth of your reach. You receive, what are they, the consumers? They're called consumers? They're patients.
They're patients once they're in the hospital, but I guess they're consumers when they drive in the parking lot.
Oh, okay. Okay. But you have quite a reach there. How far do you take patients?
Well, we're probably 38 counties, soon to be 40, if we're not at 40 counties already. It's almost the entire state of North Carolina east of Interstate 95.
Wow.
That's not exactly true because Halifax County, that's a county that's soon to be in our catchment area, looks like. But if you think about east of 95, all the way from the Virginia border to South Carolina to the coast, that's a very wide piece of geography.
Big area.
It's very large.
And there was a time that you were actually running out of beds, and you had what one would almost consider a waiting list.
Oh, we did. It was hard to get in. It was sort of the idea that folks who really needed to be in were stacking up in hospital emergency rooms, not being cared for like they needed to be, and there was what we call a delay in getting in. Now that we're at the new hospital, We have a larger bed capacity. Of course, we're hiring new staff, new nurses, new folks all the time, and all of the different professional staff. And so now we're able to service more people in a more timely manner.
That's good.
So we're real pleased with that. It's putting some new challenges to having a larger patient population, but we're admitting people, I think, much faster, more smoothly than probably we have in a long time.
And this is a beautiful facility, and there's also, and I wanted to touch very quickly, and the reason we're going over this, it's been a while since you've been here, and there may be someone who's not fully aware of what Cherry Hospital is. It's a beautiful facility, and they have a very caring staff there. But I want to cover very quickly the fact that you just don't put people in and then forget about them and throw away the key and they're there for the rest of their lives. That doesn't happen anymore like it used to.
Back in the day, what we would kind of use the term warehousing, someone who's seriously mentally ill, and they would go to a state hospital and kind of maybe live large portions, if not the remainder of their life, in some institution. That's just not modern healthcare. And now our treatment is more effective and there are options. And so we'll stabilize somebody. It could be, it's as long as it takes, and that might take a few months. But then at that point, I tell people all the time, the most rewarding part of my job is to see somebody in the worst days of their life, in their worst, and then in a very short time, and it may be a few weeks or a few months, they're so much better. Because their life is stabilized, they're on medication, they've gotten some treatment, they've kind of got some issues worked out, and they do much better. Now the challenge, as any healthcare is to get the follow-up and outpatient and the services they need in the community. We still struggle with that sometimes. But to see them, that they get on their feet, and so on average, people are at Cherry a few months, and then they're back at life. And then they're out and hopefully doing well, and getting the services they need, and don't come back to us. Now, if they need to, we're there.
All right. That is excellent. Is there, besides Wikipedia or somewhere like that, is there somewhere that someone could go to find out more about Cherry Hospital?
Well, Department of Health and Human Services in North Carolina, DHHS, does have a web page, and you can look at all the state facilities. But indeed, part of that, there's a Cherry Hospital. You kind of drill down through the web page. And there's a Cherry Hospital webpage that tells you more about our services, about our specific kind of target needs in terms of what issues we address, and sort of how somebody would go about contacting our admission service and looking at kind of what to expect if somebody needed the care of Cherry Hospital.
Lucky Welch is the captain of that ship, and we love Lucky. He's a great guy and doing a great job, and so are you. Our guest is Dr. Steve Peters, and Steve is the head of psychology at Cherry Hospital. Tell Lucky we said hi.
I certainly will do that.
Very good.
Indeed.
Thank you, Steve.
Good to be here.